for a couple months now, we had seen a rather steady decline in the number of vaccinations. Then we launched the I Got Vaccinated campaign in June. Not just the incentives that people talk about, but also the outreach, education, and access played a big role in that. And for the first time in many weeks, we actually saw an increase in the number of vaccinations during the first week of the I Got Vaccinated campaign. And it was kind of level the second week. And the campaign ended. Obviously, we got more shots in arms. There were fewer people willing to be vaccinated, and the decline began again. But I can tell you that over the past couple weeks, we have been just more than 16,000 shots per week. It is possible that this increase in cases and all the news of the Delta variant spreading has been motivation for some people to go in and get their shots. We'll just have to wait and see a little bit more over time because the data, there's a little data lag as the information comes in. But certainly over the last couple weeks, we have seen 16,000 and change per week, and that was like a leveling out. We would certainly, like to keep it at 16,000 every week or go up. And look, if there ever was a reason to go get vaccinated, today's news is that reason. 243 new cases today, our highest single day case counts since early January. And we've reported 3 more deaths today. These are not just numbers that you'll see on the evening news. These are real people. These are families. These could be people people from your community. It can happen tomorrow in your community or to your family. So, please, people, this really should be a wake-up call. If we haven't had the wake-up call yet, this can be it. 243 cases, 3 more deaths, and the Delta variant is spreading and has become the dominant strain now in the state. The numbers of the Delta are increasing on all islands. It's really time, if you've been putting this off, it's time to go in and get vaccinated and be part of the solution.
We've begged and pleaded and cajoled people. We've provided incentives as well. I mean, I'm concerned about where we are with the math. If you look at the math, we've got 582 vaccinated, 953 is our total population. That leaves 371,000 people. That's 12 plus. But if you take the 12 and under, as I understand it, that's about 14% or roughly 134,000 kids. That leaves us with 238,000 adults right now eligible to be vaccinated, and that's a small universe comparatively speaking here. And as we've seen in recent days, not just the increase in numbers of the disease, but the real slowdown in people getting vaccinated. So this is a very precarious situation that we're in right now, and I would venture to say we're in uncharted waters compared to any other phase of this disease, and we're just going to have to sort it through. But clearly, we're going to ask everybody who hasn't been vaccinated to please reconsider their positions.
One thing I will say is there was an article published just yesterday in the New England Journal of Medicine by Public Health England, which showed that our vaccines are highly effective against the Delta variant. So that's the good news. If you're vaccinated, it's good to show the reasonable precautions that Brooks mentioned. When I'm out in public, I wear a mask, and all the other community mitigation measures, such as physical distancing, are still a good idea. But it is reassuring to see this new study that shows the efficacy of our vaccines.
Something that we're asked regularly is, can we please report the day we report there are 243 new cases? Can you tell us how many of those were vaccinated or unvaccinated? And Dr. Maribin, correct me if I'm wrong, but we don't get that information right then. We hear from the lab about a positive case, and we quickly add that to the total and turn around as quickly as we can and get that information to you guys. And then we have to go back and determine vaccination status. Yeah. It would be nice. Just please know that the vast majority of the new cases are indeed people who are unvaccinated, and occasionally there is some vaccinated people who are infected because they have been bombarded with the virus.
None of us wants to go back to the restrictions that we were in earlier in the last year and a half over the course of this pandemic. And unlike 6 or 8 months ago, we have the tools that we need to prevent any indication that maybe we should even consider going back to those restrictions. And the strongest of those tools and the most effective is vaccination. So if people are concerned about the possibility of maybe going back to restrictions, you can take action to keep that from happening by being vaccinated.